During the 14th century, one of the deadliest pandemics in human history swept across Europe, the Black Plague, also known as the bubonic plague. This pandemic claimed the lives of an estimated 25 to 50 million people, roughly a third of Europe's population. Its rapid spread and deadly consequences had a profound effect on public health systems, many of which were still in their infancy. This video will explore how the Black Plague catalyzed major changes in public health practices, some of which continue to influence modern approaches to disease control today. One of the most significant responses to the Black Plague was the establishment of quarantine. In 1377, the city of Venice implemented one of the first known quarantine policies, requiring ships to dock for 40 days before their passengers could disembark. This was based on the belief that isolating the sick would prevent the spread of the disease. Although the understanding of germ theory wasn't yet developed, this practice laid the groundwork for modern quarantine measures used to control contagious diseases. Plague doctors became a symbol of the Black Plague. They wore long robes, gloves, and bird-like masks filled with herbs to protect themselves from the disease. Although their methods were largely ineffective, the use of protective gear highlights early attempts at personal protective equipment. Over time, this evolved into more scientific approaches to protecting health workers from infectious diseases. The sheer scale of the Black Plague led to significant improvements in public sanitation. Cities across Europe began to address waste management, improve street cleaning, and establish burial practices to handle the vast number of dead. The horror of the plague forced societies to rethink how they managed the spread of diseases, laying early foundations for modern sanitation systems. Though the Black Plague devastated populations, it also left a lasting legacy on public health. It spurred the developments of laws governing health practices and the establishment of health boards in many cities. These early forms of organized public health efforts paved the way for future advancements in epidemiology and disease control. While the world has made great strides since then, the Black Plague serves as a stark reminder of the importance of public health preparedness and intervention. In conclusion, the Black Plague not only reshaped Europe's population, but also transformed public health as we know it. From quarantine measures to improved sanitation, many of the practices that emerged during this dark period laid the foundation for modern public health systems. It reminds us of the importance of learning from history to better prepare for future health crises.